Namaskar. We would like to welcome you all on our 502nd milestone of AYUSH Samriddhi journey of brainstorming, knowledge sharing to second generation. And now this journey has passed 500 episodes, and definitely as it is brainstorming journey, knowledge sharing journey, definitely it will be infinite to the end. So, without wasting much time, I would like to communicate you all that on demand of 80% audience, we have shifted our time from 7 p.m. to 9 p.m. this month. We are experimenting that whether we are able to involve maximum person or not. So now I would like to request all the audience and all the experts to invite maximum possible students and faculties, because 9 p.m. is the time when everybody is at the rest at his home approximately. There is no transaction time, no transportation time, no mess time, no canteen time. Everybody is bound to return in the hostel before 9 p.m. as per general hostel guidelines. So, we welcome you all. Thank you for the joining. I welcome Dr. Vishnu Prasad Sharma ji. Pranam sir. I welcome Dr. B.K. Agnihotri sir. Welcome sir. Dr. Leena Karekar ji is also with us from Gujarat. Welcome. Dr. Anand Katti ji from Bangalore. Dr. Harish Verma ji is from Canada. Welcome. And now today's speakers, Dr. Abdul Aziz Khan from Aligarh Muslim University. Welcome. Welcome, Dr. Aziz. Welcome on the platform.
Thank you, sir. Thank you so much.
And we would like to request you that please recommend on Unani speakers for each and every webinar, because AYUSH is incomplete without you. You are important for AYUSH.
So, definitely, sir. Definitely.
Thank you very much for joining.
Thank you. Thank you.
Jagdishwar ji pranam. Hema Malini ji pranam. Nishant Shukla ji pranam. So now I would like to invite Professor Vishnu Prasad Sharma ji for his welcome blessing. Welcome.
Pranam. Okay, namaskar.
Namaskar.
Good evening to everybody. Respected Professor V.K. Agnihotri ji, respected Professor Pavan Kumar Verma ji, distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Dr. Vishnu Prasad Sharma, welcome all of you to this evening webinar on AYUSH for Age. It is the most important subject today's webinar. So in this today's webinar, we have eminent speaker. I want to welcome the eminent speaker, Professor Nishant Shukla, Professor Kaya Shri V.M. Mehta Ayurvedic College, Anandpur. I welcome you, sir. Namaskar. Next, I want to welcome Dr. Abdul Aziz Khan, Assistant Professor, Faculty of Unani Medicine, Aligarh Muslim University, Aligarh. Namaskar. Welcome you, sir, to this evening webinar on important subject, AYUSH for Age. So once again, I welcome all the eminent speakers, distinguished guests, ladies and gentlemen, to this evening webinar on important subject, AYUSH for Age. How we can show good result regarding age. So thank you. Namaskar. Over to Pavanji.
I welcome Dr. Himanshu Shekhar Tiwari from Multani and would like to request him to please invite. Various points are there for industry in this month. So please invite speakers. And Dr. Sudhakar Reddy ji from Mysore. Welcome, sir. Welcome. Now I would like to request Professor V.K. Agnihotri, sir, for his initial comments.
Thank you, Dr. Pawan Sharma ji. Namaskar. It's great pleasure that we have crossed 500 webinars, and now we are standing on 502nd webinar on today with a very special day designed for the AIDS. So it's a World AIDS Day, and we have got a very important and distinguished guest speakers. They will throw light over the today's importance and also the importance of the AIDS itself. As we all know that though it is AIDS, and that in our Ayurvedic system, it directly reflects to the immune system or the body's immunity itself. As long the immunity will be at top or at the mark, any sort of infection or any sort of disease will not take place apart from the some metabolic disorders, which can also be managed by the betterment of the lifestyle. So this is happening for last 30 years or plus 30 years, and we have talked a lot, and we have got so many data. Bill Clinton and his association, lot of budget is being diverted for the management of the AIDS patient itself globally. India is also one of the countries which is getting benefited. But the basic fact is that how AYUSH can do. So AYUSH, we stand for Ayurveda. Our Abdulajit sir is standing for Unani. Naturally, homeopathic persons are also there, Siddha also there. Our great scholars are today well joined, Dr. Harish Verma ji, Dr. P. Sudhakar Reddy ji, so our Dr. Professor Sejoria ji. So we will be having a very good evening today, and a lot of information will be available to all of us, those who have joined and those who will view directly live on YouTube, and those who will visit our archives. So our good wishes are that how can we able to improve the body immunity to face any of the disturbance happening in the anybody's healthy lives. When it comes a matter of AIDS, very naturally, what is being provocated or say advocated throughout the world for last 30 plus years, and what for the Ayurveda stands, AIDS versus AIDS. And we have got a very good information from our respected Dr. Professor V.K. Sharma Sahab, who had been the principal of State Ayurvedic College Lucknow. He talked about that in what way we can approach. So our approach is that to go for the better lifestyle, and better, our slogan will be to manage ourselves with the immunity enhancing factors in cases of actions, in cases of diet, and we will be having the better tomorrow. So with these initial words, we welcome today's guest speakers with the view that we are going to have a lot of good information from their end. So thank you so much. Over to Dr. Professor Pawan Sharma ji. Namaskar.
Thank you, sir. Thank you very much. Now I would like to request Professor Nishant Shukla ji. Welcome, Nishant ji. Welcome. You are always inspiring. Now we are eager to listen. Welcome. Your slides are visible. You can go for slideshow.
Namaskar.
Namaskar.
Is my slides are visible?
Yes.
Okay. So
please go for slideshow.
Yeah, definitely. Today I've got too many slides to share. So this time I have just starting with a different view. I will be dealing with the cases first, and then I will go with the theoretical part. There are some cases that I have treated and I have seen being treated by my grandfather, because the first case of AIDS was observed somewhere in the year 1991, and a person from Africa came to my grandfather somewhere in mid 92, and from there he has got too many cases, and he has successfully treated those cases. So some of the cases are from his records, and some of the cases are from my records. I have selected some cases and that I am presenting in this webinar. So first I am coming directly on the case number 1. This was the case of a 40-year-old person, Indian national. Just right now I was just mentioning the same case that was treated by my grandfather. He was residing in Uganda, developed fever and chills, malaise, vomiting, and his pathological reports showed that the patient was having the P. falciparum malaria. That was the first initial diagnosis for the raised temperature, and the patient was treated for a month period for the treatment available at that time for the falciparum. There was no response with the medicine, and the patient was further studied for the different pathological investigation, and at this second moment he was diagnosed that the patient was Vidal positive, and he was treated on the lines of the typhoid. The patient received the antimicrobial therapy, but the same result was observed with the medicine, and there was no improvement in the clinical sign, and all the biomarkers were suggestive of the disease. The patient was investigated further and diagnosed to be suffering from dual disease, that is the pneumonia and tuberculosis, both in the lungs, lung pathology. The patient was subjected to AKT for 6 months, and the person doesn't have the improvement in any of the clinical signs, and further developed weight loss, loss of appetite, recurrent diarrhea, and all the symptoms. Now, at that time, the AIDS was a very new to the medical system, and afterwards, the patient was investigated for the ELISA, and the patient was found to be having positive for HIV. The patient came to my grandfather with these medical history. Now, how was his approach in treating the condition? First was considering the medical condition as a Vishamajwar, as the patient was having the initial sign of malaria, followed by the typhoid jwar. Now here, when we see the translation of 5 types of jwara, santata, satata, anyadyosh, tritiya, chaturthak, that is the 5 Vishamajwar, we simply translate it with the malaria. But in my opinion, as well as the opinion of Dr. C.P. Shukla, my grandfather, he was of the opinion that these are the specific fevers, and the typhoid can be very well be explained on the grounds of this satata jwara. There is a diurnal variation less than 1 degree in the satata jwar, and the fever continuously goes for a period of 2 weeks to 3 weeks. Saptahadva, Dashahadva, Dwadashaha, Tatha Piva. So in that way, the fever is having the typical temperature pattern, and with the diurnal variation of less than 1 degree. So this is comparable with the satata jwara. The tuberculosis or the yakshma is occurring due to the debilitating disorder, the constitutional illness. This is the Nidanarthaka Roga due to the jwara. And the yakshma literally means there is a group of disorder. So on that basis, that was the treatment plan. This is the reference, Nidanarthaka Roga, Jwara Sanjayate Shosha. Now, this was the viral load. That was with the records what he got. There was an improvement in the viral load. Afterwards, there was no viral load examination done by the patient, but there was the patient has good clinical improvement. This is after a period of approximately 6 months. The absolute CD count improved with the Ayurvedic treatment. The modern treatment, whatever he was telling at that time, antiretroviral therapy was not readily available. So the patient was given the 3rd generation antibiotics. The fourth generation was also not available at that time, and the patient was treated with the empirical antimicrobial therapy and with adjuvant or as a parallel therapy with the Ayurveda. And these are the two important changes that has been observed with the treatment. Now, there was a marked clinical improvement. That was a very important thing. The patient, the presenting symptom, the debilitating condition, performance of the work, coughing, diarrhea, these symptoms has reduced to a marked extent. So there was a very limited change in the viral load, but the feeling of well-being or the improvement in the general well-being was markedly improved, which is not observed with the antimicrobial therapy or antiretroviral therapy. This is the very biggest part what Ayurveda can play. Now, when we see, I will talk in this one later, what is the role of Ayurveda and what may be the role of Ayurveda. Now, can we take the Ayurvedic medicine all alone and treat AIDS, or we can put the patient with as an adjuvant therapy or a parallel therapy? The patient continues with the Ayurvedic medicine and he can take the antiretroviral therapy nowadays what is available. So a parallel or conjugation of these therapy can be the medicine for tomorrow. The feeling of well-being was observed in patient normal appetite, digestion, sleep, awakening, and able to perform the normal routine activity without any problem was observed within the period of 2 months. Reduction in the viral load and improvement, it was observed in CD3 count. That CD4, CD48, they were not available at that time. So I don't have that record with me. So this is the change that was observed with the Ayurvedic treatment what my grandfather has given. I will share what he has given afterwards. This is the patient in Gondal. This was patient treated by me. Basically, the patient was having the venereal disease. Patient was having the gonorrhea, and so that was also a sexually transmitted disease of grade 4 category. And the patient presented with the symptoms of neurologic CNS. The first symptom was the tremor in the hands. There was a recurrent diarrhea not responding to the conventional antimicrobial therapy. There was a marked weight loss and loss of appetite was the presenting symptom. Now, I've gone through history of the patient, and at that time, before being infected or developed the symptom of STD, the patient has the symptom of herpes zoster, and patient has the neurosyphilis. Now, the history, the personal history shown that the patient has to pass the stool for 2 to 3 times, well-formed, non-sticky, with mucus, at times or without mucus. The urination was normal. The patient was non-alcoholic, non-smoker, but had a history of physical contact, and the build was mentioned in this. Now, these are the medical records of the patient. The VDRL was positive. The Western blot was positive in 2005. The diagnosis, confirmation of the diagnosis was done with the Western blot. ELISA was considered to be a screening test, and Western blot was considered to be the golden marker for diagnosis of the HIV. At that time, the PCR was not available readily, and the diagnosis was done at the Ahmedabad. The other reports were suggestive of hepatomegaly and colitis with the old lunar infarct. Now, what approach was taken for clinical management of the patient? This runs like this. Patient has a complaint of diarrhea, neurosyphilis, general debility, which are the key factors for the diagnosis, and that needs to be attended. The patient was diagnosed with HIV. Now here I would like to highlight one thing. When we see the definition of disease as per Charaka. Vikaro dhatu vaishamyam. This has been taught in our BMS syllabus, but practically we don't take it for our clinical purposes. Now, when we see the changes, that is the changes in the host mechanism or the pathology, the condition of the cells, the conditions of the dhatu, condition of the srotas, which has been deviated from the normal or the normal homeostasis mechanism. This is the pathological change. Mere the entry of any microbial agent cannot be considered as infection. When we see the classical definition of infective disease, this clearly mentions, and this is analogous to what is narrated in Charaka. So, what is required when we talk of Ayurveda, and when we want to go with the system of Ayurveda, we need to understand the changes in the dhatus. And though it was the patient was having the infection of the HIV, but the presenting symptom was of the Annava Srotas and the Purishva Srotas. So the treatment was given as per the general measures of the Purishva Srotas one, second, general measures of Rasayana, third one, general measures of improving the body immune host. So this was the approach taken for managing this patient. The patient developed the signs with diarrhea. The primary objective was to control through immunity and the host defense. The disease organ is already I have discussed. Patient, now what happens in the first phase of the treatment? The treatment was given to control diarrhea, improve digestion, improving liver function to improve the general health. The following treatments were given. The cottage Ganvati was given with warm water. Shankvati and Sanjeevani was given with the warm water. Now, this three medicine doesn't direct effect on the immunity. This three medicine is directly having the effect on the srotas which is involved. So, primarily the site which is involved in the disease process was treated first. Sthanam jayati purvam tu sthanastasya avirodhata. Looking into this fundamental, this treatment was planned. And what was the changes? There was a control of the improvement. After controlling of the symptoms, the other medicine, after this medicine was continued, once the symptom control was observed, the patient stopped, patient has reduction in the diarrhea, the digestion improved. Then this was given. The Shatavari, Rasayan therapy with Shatavari, Yashtimadu, Datrilo tablet, and Balya combination that is narrated in fourth chapter of Charak Samhita. I am making the tablet of that one. And this was given to the patient for improving the immunity and general strength. Now, these are the do's and don'ts. These are the changes in the viral load. Now here, the patient had improvement. The last one, 83. I am not satisfied, and I don't claim that it is completely recovered, as there may be the chances that the false negative result may be observed in condition where there is a no threshold, when it goes beyond the minimum threshold limit. So the patient may have the dormant virus in the body, but they may be not perceivable, and so the patient had the zero value in the viral load. So these are the changes. There's a BT1 and BT2 before treatment score. There was an increase in the viral load, and gradually with the Ayurvedic treatment, after 3 years, the viral load 83 was after treatment, 3 was after the 3 years of the treatment, and by 2010, the patient has no clinical evidence of symptom. The patient continued the medicine till 2013, and patient lastly came to me in 2019 at that time, patient was not having any problem. The patient was from Gondal, Gujarat. These are the changes in the lymphocyte CD3 values, absolute. These are the CD3 and CD4 values. Now, summing up of this clinical success, the marked improvement is observed in the clinical symptoms of illness. General well-being was improved from the very beginning of the treatment. Viral load was decreased and absolutely zero. The negative Western blot and ELISA was observed by 2 years of the treatment. But as far as when we see the cases to be cured or stating whether the case is cured or incured, I strictly follow the guidelines of Charaka. When we see the definition of Chikitsa, Charak narrates synonyms of the Chikitsa: Chikitsitam Vyadhiram Patyam Sadhanam Aushadam Prayashchittam Prasamanam Prakruti Sthapanam Hitam. The Prakruti Sthapana is the means the restoration of the normal homeostasis mechanism. But as on today, I don't have that specific markers to identify the normal homeostasis mechanism, and that's why I am not stating that this is a complete recovery or a complete cure. That's why I am just mentioning this as a good improvement, not as a cure in this case. And this is the solo case where I have got the complete recovery. These are the reference. These are the snaps of the reports. Now it was the third patient. Patient was from he was diagnosed with the HIV. The presenting symptoms were the debility, general debility, malaise, recurrent fever, diarrhea, coughing with expectoration. Similar scenario was observed. The respiratory tract was involved in the disease process, and the patient was not getting the improvement with the conventional antimicrobial therapy, and the patient was then investigated for HIV, and he was found to be positive with the HIV. Now, these were the condition of the patient at the time when he came to my clinic. So now what was the approach taken? Now here in this one, the Roga Sankara with the debilitating Deha Dhatu was the key of the diagnosis, and that was treated with the Ayurvedic medicine. The primary impairment was the Jatragni, pyrexia and diarrhea are considered to be the disease occurring due to the impairment of the Jatragni. Jwara is the derangement of the Agni leading to the transportation or shifting of the Agni from Jatara to the Bahya Srotasa. And similarly, in Atisar, the Jatragni takes all the body fluids to the colon area, and that increases the watery content, and that goes out in the form of the watery stool. So the Agni was considered to be the most important, and that was treated. Owing to the Agni impairment, Dhatu body tissue vitiation was observed and diagnosed, labeled as Ojakshaya Janya Jwara. Now here I would mention the three conditions narrated by Charaka that I would take in details in afterwards. The three conditions stated in Vishama Jwara: Sapratyanika Bala, then Nishpratyanika, and Pratyanika Balakshaya. When the Pratyanika Balakshaya occurs, then the disease or the Vishama Jwara becomes incurable. This is the condition which is comparable with the AIDS. Now, patient as having the chronic debilitating illness, the weight was lost. Along with the medication, the patient was given the ghee. Snehameva param vidya durbalana ladipana naham sneha samiddasya samayanam sugurupi. That was the basic idea before giving the medicine, and to improve the gastric digestion and to improve the immunity, the cow's ghee, clarified butter, was given in the food. Now, what I am doing, I am Sira halwa in their daily routine food. So what happens? The patient takes that very easily with the food, and administering the ghee before in the morning or with any other is a bit difficult than administering with the food. So in this way, in the form of the kalpana, I am using the medicine as ghee as a medicine. Now, these were the plan of the management. Now coming on to improvements. There was a relief in the fever. That fever subsided and the patient started his normal activity. His improvement viral load was considerably decreased, but there was not zero. These are the changes in the viral load. These are the changes in the CD3 count. There's a CD3 CD4 ratio. After a period of approximately 3 years, what are the changes? The patient gained the weight. Increase in appetite was observed. Normal routine bowel and urine. No coughing, no physical exam, no physical signs of the disease. Stamina, that is to performance of the normal routine activity, was restored, and normal and regular sleep and awakening cycle restored. Now coming on to the case number 4, that was from the Rajkot. Patient had the first symptom of the COX, and the patient was having the comorbidity of HIV and the COX. So the patient was given the treatment as per the directives mentioned in Charak Samhita for treating the Yakshma. In this one, along with the medicine, the goat's milk, I'm not using goat flesh, I'm using the goat milk for the treatment. And the treatment, whatever was there, the medicines that I have dispensed, was suggested to be taken with the goat's milk as a vehicle. Now, the details of the patient is, the patient presented with low-grade fever, coughing, weight loss, stability. The patient was primarily diagnosed with the pulmonary COX infiltration. The patient was managed with the AKT. After the period of 6 months, the patient symptoms were not reduced and the patient had the recurrence. So that was a failure case. And then the patient was investigated for the HIV and was found to be positive for the HIV. These are the general presentation, the part of the history at the time of coming. These are the changes in the viral load, CD3 counts, CD3 and 4 ratio. Western blot was observed to be negative. These are the changes. This was a success. Now, there are the some non-HIV MDR drug resistant tuberculosis that these have sharing. I'm not going with the details of this one. MDR, XDR and CDR, they are the problem of today's India. It's not only the managing the tuberculosis alone, but we need to understand the phenomena of developing drug resistancy. We are getting more and more infected through the drug resistant strains, and using the poly antimicrobial therapy, we are actually worsening the condition. We are not treating the dhatus, but we are treating the organism which is getting resistancy against the most of the medicine. Now, at this point of time, I would like to highlight the concept of gene changes that is this that was taught in the school text in class 11 and class 12. The genetic changes can occur due to the use of certain medicine or certain chemical agents. The very popular example is of the mosquito. That is the theory of natural selection. what happens in the theory of natural selection when the material or when the chemical agent is used for the first time, it destroys a majority population of that organism. But a few organisms that survives with that one, in that use of the medicine or chemical, now they develop their offsprings and they further infect. This was the observed with the DDT and mosquito. Nowadays, we used to tell that mosquito have digested DDT. So this is the way the natural selection. And so we need to use the Ayurvedic medicine to reduce the burden on the national medical system. So I'm just keeping the slides. These are the changes in the weight. These are the changes in the X-ray. Sputum examination changes. This was the fundamental use for treating the patient. This is the non-HIV case of tuberculoma. I'm just keeping the case. And this case was published in STM journals. You can have that snap, and you can also go with, you can go and search on the web. This is the citation. Now, coming on to the theoretical part of AIDS. Now, when we see this, when the AIDS is the acquired immunodeficiency syndrome, it is among the different immunodeficiency disease, but it is specifically caused by the infection. Now, when we want to study this one, we need to study the two things. First is the dhatu, and the other one is the ojas. So the srotas which is involved and the dhatus, the host defense, or the ojas. So this may be comparable with the condition of the ojakshaya or pratyanika balakshaya. These are the references. You can go with this one. When disease occurs or when the ojadushya occurs, this is the thing. I'm not going in the details. Now coming on to the general concept of disease. Disease is the disharmony caused by the sequence of changes within the body, humors, by external or internal causes. So eva kupita dosha samuthana visheshata sthanantaragata sheva vikaran janetbon. So this is the changes. Now here we see one patient with the pulmonary changes, one patient with malaria, the third person with syphilis, and the diarrhea. So we have got the different infective conditions. This is how the oja, or what is the concept of oja in Ayurveda. The oja is the first one that is occurring in the body. First, then the second concept is the oj is the resultant of the sar of the seven dhatu tatra rasadinam shukrantanam dhatunam parama tat teja khalu ojah, and this is referred as bala. Hridayateshtati, it is remains in the hridaya. It is the para oja and the upper oja. The upper oja circulates throughout the body. Upper oja changes can be observed, but the para oja is per oja quantity and quality of the para oja never goes down. If it goes down, there is qualitative change. The person gets illness, and the quantitative changes. Then the person dies. So, what is the concept of immunity in Ayurveda? So now to how this bala, there are the three ways. The first one is the sahaja bala. Sahajam yat sattva that is derived from the maternal side and the paternal side. The second one is the kalaja by the virtue of the season and the virtue of the kal, virtue of the time frame, and the yuktikrut by the indulgence of the regime, yuktikrutam, the indulgence of the medicament, the indulgence of the procedures, the indulgence of the purifications that can improve the strength and the host system in the body. I'm moving on to the next one. This is the history of the the history of the AIDS. The important events, what happens in the AIDS. The first one that infects the immune system. The second change that destroys the vital cells, the lymphoid derived white cells. And lastly, it results in the clinical evident disease. It may occur at any different places. This is comparable with the Ojakshaya. I'm not going in the reference. This is the reference from the Shushruta. These are the 3 stages of the Kshaya. Going on to the concept of the infectious disease. Now, when we see the Ayurvedic concept of infectious disease, we need to understand the other infectious disease and also the AIDS as per the Ayurvedic discipline. So the 4 factors are there which helps in the successful parasitism. The first one is kshetra, lowered vitality. Where there is a lowered vitality, the bija can easily enter into. The first one is bija, that is the pathogen. What is the virulence of the pathogen? It depends on whether the disease will occur or not. Second one is the nutrition to the pathogen. Third one is the time, and last one is the kshetra. Dhruvam Chaturnaam. This is the reference from Shushruta 2. These are the 4 factors which is important for the successful parasitism. If the bij is virulent, if the season is proper, the kshetra is having the lowered vitality, and the pathogen is getting the proper nourishment or proper replication without hindrance, then there is a high virulence or high toxicity, microbial toxicity, and that may lead to disease. This is the same thing what I was narrating. As the time has less, I'm just keeping the slide. Now, how to manage and what should be the approach? The primary objective of the treatment ought to be reduction in the HIV replication and reduction in HIV load. If we are able to reduce the HIV load, that will help in increasing the lifespan of the patient. This is the first and primary objective. No one can be immortal. We need to keep this in mind. The immortality, we are not discussing about the immortality, but we can definitely improve the quality of life. One, and second, extend the life. Dirghan Jivitiya. We can improve the quality and we can expand the productive life of a person. So reduction in the viral replication and the viral load would help in increasing the longevity of the patient first. The secondary objective is to control the symptom. What happens with the ART? There, the ART is having the problem of itself. The ART is having the limited usability due to its complications and adverse drug reactions. So what can be done? So the ART can be used with the conjugation of the Ayurvedic medicine. We need a proper tuning with the medical person, and they should accept us that the treatment can be given, Ayurvedic treatment in the form of the medication or the purification can be given, clubbing that one treatment, a proper amalgamation for a better outcome. So what is the second objective? Is to control the symptom, arresting the secondary opportunistic infections like tuberculosis. So if we are able to at least arrest the secondary opportunistic infection, that will add up to the longevity, improving the general health condition of the patient, improving the digestion, metabolism, sleep, awakening, physical and mental well-being. That is the improvement in Dehabala, Chittavala and Agnivala. And lastly, arresting the sequel that can improve the life expectancy. Now, this has already been discussed. Now, with the antiviral therapy, when we see the Ayurveda, the antiviral effect is all observed in Bhumya Malki. This can be comparable with the Raktaj Krimi. I'm not going in the details of this one. And when we see Krimi, the most important treatment modality narrated by Charaka is the Prakruti Vigata. Prakruti here means, there are the different meanings of the term Prakruti. And in this particular context, the word Prakruti means the factor that allows and facilitates the bacterial growth within the body. So the factors that restrict this bacterial growth, this microbial growth, it's not about the eliminating, it is just to cut the replication of these agents, and after that one reduction. Yeah, I'm just concluding. I would take only 5 minutes. This is the Prakruti Vigata. Prakruti is the nature that helps to proliferate the parasite and stopping the indulgence of the drug therapeutic procedures, food routine that disfavors the parasite growth. This is usually done with the pungent taste. There's one article of mine in STM journal, and in that I have just presented 3 cases of hepatitis B. They were successfully recovered from the hepatitis B infection, and they were given the 3 different drugs. The common drug in them was the Kiratikta Sudarshan Vati, so the Mahasudarshan Vati, with the same principle of Prakruti Vigata. So along with that one, some medications were given as per the condition of the patient, but there was improvement in all these 3 patients. You can get it from the STM journals. So these are the therapeutic principles, whatever I have just narrated in English. These are from the Charaka, these are the references. I have just make this presentation for the international seminar, and so these are all in the English. So this is the how we can treat the different conditions, the Ojakshay or the AIDS. These are the medications which can be imported, which can be used. Relaxation needs to be observed. Physical activity, diet, and stress management, these are the triad of the vitality wheel. And if these 3 are properly managed, the wellness is observed. Why Ayurveda? Now, this is the biggest question. Now, the modern contemporary medical science is developing a lot of things for the management, but the question is, why Ayurveda? Why we need to Ayurveda? This is natural origin. Strengthening natural host defense mechanism. It improves the general well-being, which is not commonly observed with the contemporary medical system. And lastly, the body and environmental friendly medicine is there. If you want to succeed, you should strike out the new path rather than traveling the worn path of accepted success. That was the words of John D. Rockefeller. So I've just tried and attempted to follow this lines with the grace of my grandfather, with the grace of Lord Dhanvantari, and some of the success that I have received in clinical success that I have received in the patients of AIDS that I have narrated in this one. I have got a very few numbers to state that this can be completely cured with the Ayurveda. So I am not claiming that one. I am claiming only that I can add years to the life, but I can't add, I can't add years to the life, but I can add life to the years. With these words, I conclude my speech. I am thankful to the organizers, V.T. Agnihotri sir, Dr. Mahesh Sharma sir, Dr. Sharma sir, for giving me the chance to speak on a very important international, global health issue. Thank you once again for giving me the chance, and thank you. I'm thankful to the audience for the hearing. If there are any questions, I would
Your last
answer
slide was
as
so
per
humorous.
my knowledge and what am I having.
Thank you. Thank you. So
I
now,
have taken
thank
2
you.
minutes. I have taken so much time today. I have taken approximately 1 hour. I'm extremely sorry for that one.
No problem. No problem. But
No, sir, it
your
was very
speech
informative.
was so practical and mesmerizing.
It was
that
very
we
informative.
couldn't stop you.
Thank you very much.
Thank you very much.
Now, I would like to invite Dr. Abdul Aziz Khan, Assistant Professor from Faculty of Unani, Aligarh Muslim University, Aligarh. Welcome. Welcome, Doctor. Yes.
My screen is visible?
Yes, kindly communicate your department's name also. Social Preventive Medicine. We want to pronounce it correctly.
It is Tahaffuzi wa Samaji Tib.
Tahaffuzi wa Samaji Tib.
Yes.
Thank you. Thank you. Thank you so much.
So may I start?
Yes. Platform is yours.
Okay. Thank you very much, sir. I'm highly thankful to your organization, AYUSH SAMRIDDHI webinar series. This is the 502 series in the continuation, and I have been invited by your kind self. Thank you very much, Professor Pavan Saab. And I'm thankful to Professor V.T. Agnihotri and Professor Vishnu Sharma, and recently who just delivered lecture, Professor Nishant Shukla. Really, it was a very marvelous and very understanding lecture, and very comprehensively covered the various aspects of the AIDS, HIV, and what an indigenous system of medicine can propose for the betterment of the human being and the ailing masses. I'm trying my level best to put you before the various concepts and different approaches which have already been discussed, so I will skip that one. But I've taken in a two-part. First one is what the WHO is saying about this AIDS Day. Today is the 1st December, and 1st December is just designated as the World AIDS Day. So I will be just focusing on the WHO's proposal, their key messages, and after that, what the palliative care can be given through the Unani system of medicine. The global HIV response is in danger, even as HIV remains a major public health issue that affects millions of people worldwide. Over the last few years, progress towards HIV goals has stalled, resources have shrunk, and millions of lives are at risk as a result. Division, disparity, and disregard for human rights are among the failures that allowed HIV to become and remain a global health crisis. On 1st December, WHO joins partner to commemorate World AIDS Day 2022 under theme Equalize. WHO is calling on global leaders and citizens to boldly recognize and address the inequalities which are holding back progress in the ending AIDS, and equalize access to the essential HIV services, particularly for children and key population and their partners, men who have sex with men, transgender people, people who use drugs, sex workers, and people in prisons. The key message just shown and displayed by WHO, I'll be taking those three. Very important, those three. One are the first one is the renew our commitment to end HIV. Persistent economic, social, cultural, and legal inequalities and challenges posed by the COVID-19 pandemic and other global crisis requires renewed efforts to maintain visibility for HIV and to end AIDS as a public health threat. The second one is focus on equality. inequality still persists for the most basic services like testing and treatment in regard to AIDS. We must ensure that everyone, everywhere, has equal access to HIV prevention, testing, treatment, and care. Health services should be adopted to reach and meet the needs of the population most at risk and affected, and this includes implementation of a zero tolerance policy to stigma and discrimination in all health services. And the third one is elimination litmus test, that is children and key population. If you find that as of 2021 data, 38.4 people live with HIV, and out of that, 1.7 million are children. So WHO recommends a renewed focus on the population that have been left behind in the global response to HIV and AIDS. Only 52% of the children living with HIV are on the life-saving treatment. If we can show progress in ending new infections among children and ensuring all are on quality antiretrovirals, we have greater hope and can ensure greater political commitment to end AIDS in all population by 2030. That is the goal for sustainable development. Globally, 70% of new HIV infections are among people who are marginalized and often criminalized. We can only end AIDS by scaling up HIV services and removing structural barriers and stigma and discrimination of key population in every country. So I've just made, but I'm skipping this one. What is HIV? What is AIDS? That all is, taken by Professor Nishant Shukla in a very well manner. So I'm coming to my main topic, that is a palliative care and what the UNANI proposes. If we talk of palliative care, it's an interdisciplinary medical specialty that focuses on preventing and relieving suffering and on the supporting the best possible quality of life for the patients facing serious illness and their families or loved ones. The primary tenets are symptom management, establishing goals of care that are in keeping with the patient values and preferences, consistent and sustained communication between the patient and the caregiver, and the psychosocial, spiritual, and practical support both to the patient and their caregivers. For patients with a variety of advanced illnesses, palliative care is applicable early in the course of the disease in conjunction with these disease-modifying therapies. The simultaneous care model, it is not limited to end-of-life care. The primary goal of palliative care is to improve quality of life for the patient and their families through relief of emotional and physical symptoms. So we all know that in any family, if there are some HIV patient, some AIDS patient, the whole of the family is stressed upon, and there's a lot of economical burden and social burden on them. Other key services are establishing goals of care that are based on the patient's values and preferences, advanced care planning, psychosocial, spiritual, and bereavement support, and coordination of care. Empirical support for the benefit of early palliative care intervention in the management of serious illness comes from randomized trials showing that palliative care, when delivered alongside disease-modifying treatment, enhances quality of life, lowers the cost of the care, and may improve survival. Much of the data derived from the patient with advanced cancer, but an increasing body of evidence supports the benefits of early palliative care in a variety of diseases. In the patients with HIV/AIDS, palliative care can help by managing symptoms and treatment side effects. These include pain, fatigue, shortness of breath, depression, anxiety, nausea, vomiting, and diarrhea. If we talk of UNANI palliative care, as we all know that UNANI system of medicine is one of the oldest system of medicine that aims at preservation of health, management of diseases, and restoration of healthy lifestyle. It provides preventive, promotive, curative, and rehabilitative healthcare with holistic approach. UNANI medicine also believes that Tabiyat Mudabbare Badan, that is medicatrix naturi, is a supreme power which controls all the physiological functions of the body, provides resistance against the disease, and helps in healing naturally. The UNANI system of medicine is holistic in nature. It takes entire constitution of the individual and lifestyle into the account for diagnosing and prescribing the treatment. Physicians select the drugs and regimens according to the temperament of the patient and the nature of the disease. In disease like tuberculosis, AIDS, cancer, etc., where the long-term therapy is required, a number of UNANI drugs, namely Hamira Marwari, Dawaul Kurkum, Habib Jawahar, can be used as an adjuvant. They play an important role in reducing the toxicity of the synthetic drugs and in modulating or enhancing the body immunity and improving the overall quality of the life. The United System of Medicine provides very comprehensive, specified, and individualized guidance for this purpose. Both promotion of health and treatment of disease can be done at a greater extent by non-drug factors, which are safer, cheaper, and more easily employed than drugs. So the United Palliative Care can be abided by the following principles of the Asbab Siddha Daruriya. Asbab Siddha Daruriya are the 6 essential factors which can be listed as Hawa, Makul wa Mashrubat. Hawa is the air, that is the ambient air, the air around us, and Makulat wa Mashrubat, that is the food and drinks, what we are consuming. Then Harkat wa Sukun Badani, that is physical activity and rest. Then Harkat Sukun Badani, Nafsani, that is the mental activity or psychic activity and rest. Then Nom wa Yakza, that is sleep and wakefulness. And 6th one is the Ihtabas wa Istafrag, that is the retention and evacuation. So I've just made in some slides to propose that how we can have helpful in treating the patient at proposing palliative care to the patients of AIDS. Actually, one of my PG students just doing PhD topic on a cancer patient in Jawaharlal Medical College, and we have proposed the same model, and we have just provided all the facilities to her that if we can just propose as a adjuvant therapy to the cancer patients, so we can propose this to the AIDS patient also. So I'm taking one by one in a very short manner. So fresh air and pollution-free air for breathing, avoid exposure to excessive heat or excessive cold, because any extremes can be very harmful to the patient which are already immunocompromised. The second one is the Makul wa Mashrubat, that is the food and beverages, food and drink. So it has been recommended that the patient must avoid junk food, smoked food, preserved food, or alcohol or carbonated drinks. He should avoid soda producing food. We have a humoral theory like Ayurveda, the dosha theory. We have 4 humoral theories. This is of the Akhlaq Arba, that is Dam, Balgam, Sauda, and Safra. So these are the diseases which are long acting, which are dealt under the Saudavi Amraz and sometimes under the Balgami Amraz. So we used to avoid the medicines or the foods that can produce Sauda in the body, that is the black bile, the red meat, dried and salted meat, and fish, etc. The patients are advised to take soft and easily digestible foods, consume turmeric, tomatoes, garlic, flaxseed, spinach, broccoli, pomegranate, etc., etc. They must be advised to take diet rich in fiber, that is 20-30 grams per day. Here, just some interventions can be given that if the patient has a loss of appetite, so we can advise Habbe Papita to take as a supplement, so that will be increasing his appetite. And if it's a problem of vomiting, nausea, and GERD-like symptoms, we can give Kurse Nankha, Kurse Mukhtar, Jawarish Podina with Arfe Nankha. These are the very remarkable results in any kind of patient we give that. I have just so many patients of this. One of them was having GERD, and he has some changes in the rhythm of the heart rate. And he was suffering from arrhythmia, and that all because of this GERD. So he come to me. He was a dentist in medical college. He just contacted us, and we treated in our OPD. We have got very good result with these 4 medicines, that is Kurse Nankha, Kurse Mukhtar, Jawarish Podina with Arke Nankha. And pain is one of the very important complaint, or you can we can manage it by just simple modifications, by giving certain medication. We have doing Ilaj Bit Tadbir that I have not mentioned here. Just Ilaj Bit Tadbir is one of the modules of treatment in United System of Medicine, where we can give massage, we can go for exercises, we have cupping therapy, so many things. But massage can be another better intervention. And if we talk of intervention in the form of the medicine, we can give Barshasha. Barshasha is a very good medicine for the pain relieving, that we given twice daily, or we can apply certain liniments or oil as described in the classical literature for like Roganesur, etc. So if the ideal of the patient, the activities of daily life is improved, then we can say that we can just provide a better life, because the main aim of the palliative care is to give a quality, to improve the quality of the life. Third one is Harkat Sukun Nafsani, that is the Harkat Sukun Badani, okay? Then Harkat Sukun Nafsani. We can recommend that we should avoid, that patient must be taken care of, that he should avoid mental stress and anxiety, extreme emotions like anger, fear, sadness, and they must be trained to go for a spiritual, peaceful life. We can intervene by holistic counseling for the patients, as we deal human being as a bio, socio, and psychological unit. Because holistic counseling may have a different approach, because when we be the Ayurveda or the Unani people or the Siddha people, when they are treating a patient, they are just not taking of the just a disease they are going to treat. They are taking care of all his body, that what is the effect of the drug on the body and what can be the side effect. So we have a concept of musle, that we give the corrective measures. If we are giving some alag darjat, that are the four darje chaharum drugs of darje chaharum, so we give some muslihat if it is required there. So holistic counseling, in that way, we have to take care of all the component, that is the biological component of the human individual, sociological component of the human individual, and the psychological component of the human individual, and general counseling to the attendants of the patients. And the fifth is the nom vayagza, that is sleep and wakefulness, because these should be in the normalized way. If we talk of that, if we in our concept, in our system of medicine, nom or sleepness produces brudat, that is coldness, and wakefulness produces dryness. If there is dryness, that can also have a negative effect, because dryness is the quality of the soda, and soda may be the very deteriorating to the patients of AIDS or the cancer. So we have to just advise the patient by any means, he or she may go for sleep, sound sleep for 6 to 8 hours. And we can advise for head massage of the Rogane Khashkat. One of the best medications can be used before going to bed as an alternate or daily basis. Even we can advise, there are medicine which I could not mention here. Actually, I was informed about this presentation a day before. I have so many present. Today I have one more presentation there. Lecture was there, and one on the Pradhan Mantri TB Mukt Yojana. I have to give in another department. So I could not find so much of time to make this presentation very good, but I tried my level best. So we can just give Asrufin is one of the product from the Hamdard pharmaceutical company that can also be used as a supplement drug to produce sleep, to induce sleep among such kind of patients. And the sixth one is the retention and evacuation, that is the istabas or istabrat. So diarrhea is one of the chief complaints of the patients having AIDS. So we should treat diarrhea, we should manage diarrhea, we should ensure proper evacuation, urination, perspiration, and menstruation, avoid dehydration, and ensure retention of the electrolytes and minerals. So these are the drugs which can be given, that is a sumac as a single drug, or mufrad drug, sumac, zarishk, halila zar, each 3 gram in shira, that is given into the water, and we have to just grind it and to take shira of this, and we can add sharbate anar 20 ml to give each 4 hours in the acute condition. But if it is followed by next few weeks, then we can give habbe sumac and habbe pechi each tablet instead, if there is any instant condition happens. Otherwise, it is all managed in a time way. So coming to the last slide of my presentation, that is the conclusion. AIDS is an advanced stage of the HIV infection. The virus attacks white blood cells, so it can lead to other infections such as certain types of cancer. HIV/AIDS is now an acute illness rather than a chronic illness because of the new medicine, heart or highly active antiretroviral therapy. Palliative care is a specialized medical care for the people facing a situation like HIV/AIDS. The goal is to improve quality of life. One can have palliative care at any age, at any stage of his or her illness, and can have it with all other treatment. Thank you very much. If there is any question or query or any suggestion.
Thank you very much. Everything is to learn from you. Unani is new subject for us, and really we are learning from you experts. Thank you. Thank you. We are grateful to you. Agnihotri sir.
Namaskar, sir. Thank you so much. As we got 2 guest lectures by our 2 distinguished guest speakers, the first one was Professor Nishant Shuklaji. As his name is Nishant, he completed word of the Nisha, the night itself, and it was a Suryoday. From his knowledge, what he presented. The vital part is this, that he quoted the case histories, especially the patients which were treated by his grandfather, respected Professor C.P. Shukla sir. And again, he made all efforts or extended all information over the Ayurvedic concept. In what way we can understand the Samprapti or the Vyadishamit or the Bal itself. Even he included with all presence per and upper status. When it makes the life spoils, if at all it is a matter of infection, viral infection of AIDS, HIV. So with all information, he established the whole of the scenario that for last 30 years, right from 1991 till date, how much has been done by Ayush and IRES department. So all thanks to him, and we are really indebted for his knowledge. Now comes the number of our Professor Dr. Abdul Khan sir. Definitely, as Professor Pawan Sharma told, this is all very new, right from the terminology to the medicine's name and everything. It's great that you represented Unani system of medicine, that too in reference to the AIDS and HIV infection. So very naturally, this is the open area and rather the thirst area where each and every pathy all over the world is now searching and making all efforts to meet with the such crisis which is globally and disturbing the whole world right from last 30 years plus. So as you told that so many things are there in Professor Dr. Harish Sharma also given something in chat box that Tirfla, use of Tirfla itself for 21 days or so is of great use as far as the immunity increasing is concerned. So was the case with you. As you told so many things, that the sleep and awakeness is equally important. And again, the Habbe Papita and other Joris Pudina, these are so many preparations which are symptomatically based with the patients. If a patient is having nausea, vomiting, or some sort of indigestion, these things can be of great value. So you really touched that area, and we are all enlightened with your knowledge that we are least known as far as the Unani is concerned, though it is bilkul hand to hand. Ayurvedic and Unani system, we have got our directed and all that. So with these two presentations, as per Professor Pawan Sharmaji's, this webinar is open for the discussion. So as you sort about the questions, our big dignitaries which are there on our today's platform, they will come forward to say something. So over to Dr. Pawan Sharmaji. Thank you so much. Dr. Pawan Sharmaji.
Thank you. Thank you very much, sir. Thank you very much. Really very nice webinar today and on new subject. Tomorrow will be our next webinar 503 on different subject, very different subject, pollution control and computerization. So that will be a absolutely new subject for us also. Here Dr. Sakat Vasu, Dr. Rajendra Khatavkar and Ms. Sutpa Vardhan will guide us on computerization as well as pollution control of IOS industry. If anybody from Unani can contribute, I would like to invite through Dr. Abdul Aziz ji. If anybody would like to contribute through computerization in Unani or pollution control in Unani, definitely I would like to welcome. So Agnihotri ji, now session is open. You are the master. Thank you, sir.
Thank you so much. As I am seeing the platform, we have got a very distinguished persons, especially Dr. Mahesh Sharma, Dr. C.P. Sharma ji, of course, Dr. Harish Sharma ji, so and Professor Sudhakar Reddy ji. At least these 4 or 5 persons are very much with us. And I think we have got next 10, 12 minutes to get their knowledge. So voluntarily, I would like to invite Professor Mahesh Sharma ji, so that the next our respected dignitary will also be ready with some his views. So Professor Dr. Mahesh Sharma ji, you please say some word, and you are invited here on today's webinar subject. Thank you, sir. Namaskar.
नमस्ते अग्निहोत्री जी, बहुत अच्छा रहा शुक्ला जी का, अहमद जी का, बहुत कुछ सीखने को मिला। कभी प्रश्न कुछ भी नहीं है।
Well, if you are making only appreciation to both the guest speakers, I would like to invite Dr. C.P. Sharma sir you please come with some of your knowledgeful contribution on today's webinar. And next will be our Dr. Hari Sharma ji. So please, please come. Yes, Hari Sharma. Namaskar, sir.
Namaskar.
Yes, sir. Whosoever comes first, that's my pleasure. Yes, please. Mama sir, you can speak. Yes, please.
Sir.
Whether Professor Shibi Sharma, yes, if you have joined, you please say something. Yes, please. Your valuable suggestions are always solicited. Please. There may not be situation like pehle aap. I think it's better. Verma, you please start. Meanwhile, Dr. C.P. Sharma will also start. Yes, please.
Yes, sir. Yes, sir. Namaskar, sir.
Because you have contributed something, so I would like to have some clear light over your concept. Yes, sir. Namaskar.
नहीं बिल्कुल सर, ये जो दो चीजें मैं जैसे ऐसे लेक्चर सुन रहा था तो मैं नेट पे भी सर्च कर रहा था कि जो त्रिफला है, it has been found very effective in improving CD3, CD4 सेल्स जो हैं. और इसमें एक मेरा क्वेश्चन है जी डॉक्टर शुक्ला जी से, अगर वो हैं यहाँ, या डॉक्टर अग्निहोत्री जी आप भी बताएं कि जो आयुर्वेद में राजक्षमा का कॉन्सेप्ट है, इसको हम एड्स के साथ क्यों नहीं कोरिलेट करते?
बहुत ज्यादा कोरिलेटेड है, बहुत ज्यादा. मतलब it's a phenomenon that whosoever is suffering from tuberculosis is much more likelihood to get infected by AIDS, because it depends upon the low immunity. And Professor Nishant Shukla is very much with us. I think your question is referred to Professor Shukla. He will be better in position to answer. Yes, sir.
Thank you very much, sir. आप अग्निहोत्री जी, आप इतने ज्ञानी होकर भी मुझे जो है वो अवसर दे रहे हैं.
अरे सर,
तो
क्या
जो मैं समझा हूँ उसके हिसाब से, तो पहले तो जो है वो लिटरली पार्ट जो है वो मैं कवर करता हूँ जी. तो यक्ष्मा की जब हम डेरिवेशन देखते हैं तो यक्ष्मा को समूह रोगाणाम कहा है. तो सिंड्रोम जो है वो टिपिकली जो है ये उसी का जो है ये ट्रांसलेशन है. This is simply the English translation of the word yakshma. When we see this one, yakshma samuho roganam. So syndrome is more than one medical condition. एक ये बात है. दूसरी बात, जब हम ये मैं अपने स्पीच में भी जो है मैंने कहा था कि बेसिकली जो आयुर्वेद का जो कॉन्सेप्ट जो डिजीज का रहा है उसमें धातु पर जब आरोपित होते हैं दोष की दृष्टि, वो जो है ये विकार है जिसको हम दोष दूष्य समूर्छना बुलाते हैं. तो ये जो है वो कहीं ना कहीं ये थोड़ा अलग है. जब हम HIV की और एड्स की बात करते हैं तो हमारा जो है वो कॉन्सेप्ट या फिर हमारा जो है वो दृष्टिकोण केवल वो HIV के ऊपर ही जो है वो रहता है. अभी एक जो है ये मैं इस बारे में एक शेयर करना चाहता हूँ, जो मैंने 2020 में एक आर्टिकल मैंने लिखा था, ये कच्छ मित्र में ये पब्लिश हुआ था, और वही जो है ये AIR भुज पे ब्रॉडकास्ट हुआ था. दैट वाज इन कोविड. अब उस समय तक इंडिया में कोविड नहीं था, पर 2002 में कोविड यानी सार्स जो है ये चाइना, ताइवान उस समय उस एरिया में था. और उस समय तो जनवरी 2020 में तो जो भी केसेस थे वो चाइना में ही थे और WHO उस पे कंसर्न थी. तो उस समय मैंने इस चीज को जो है वो लिखा था कि भाई दिस इज बेसिकली ए वेरिएंट ऑफ न्यूमोनिया, एक्यूट वायरल रेस्पिरेटरी इलनेस. और ये मैंने लिखा था, ये बेसिकली जो एक कॉन्सेप्ट जो था मैंने जो आधार रखा था वो सेसिल्स टेक्स्ट बुक ऑफ मेडिसिन के आधार पर और हैरिसन टेक्स्ट बुक ऑफ मेडिसिन के एक्यूट रेस्पिरेटरी इलनेस का, वायरल रेस्पिरेटरी इलनेस का जो चैप्टर था उसके आधार पर मैंने ये लिखा था. और उस पर जो है वो आयुर्वेद का कॉन्सेप्ट, इस चीज को मैंने हाईलाइट की थी. तो कहीं ना कहीं ये चीज है कि भाई टर्मिनोलॉजीज में भी डिफरेंट, बट अप्रोच जो है ये हम उस प्रकार से जो है ये रख सकते हैं। टर्मिनोलॉजीज भले हम आज अपना ले, क्योंकि एक्सेप्टेबिलिटी उस टर्मिनोलॉजी की है, पर सिद्धांत के रूप में अगर हम ये करते हैं तो ये अच्छा है। पहले मैं वही उसी पे आ जाता हूँ कि यक्ष्मा को हम एड्स के साथ कंपेयर कर सकते हैं, एक। दूसरा, यक्ष्मा की चारों जो प्रक्रिया से बनती है, 4 निदान का है बेसिकली, ये 4 निदान ही, ये 4 प्रक्रियाएं हैं। एक धातु क्षय से होता है तो ये जो है वो प्रतिलोम क्षय से भी होता है और अनुलोम क्षय से भी होता है। प्रतिलोम क्षय से हो रहा है तो वो पूरा का पूरा जो है वो क्षय पहले शुक्र का हो रहा है, तो यहाँ पर भी जो है वो शुक्र धातु क्षय से डेफिनेटली जो है ये हो रहा है, उसको हम ले ही सकते हैं। और उसके साथ साथ इसको जो है वो अग्नि का दृष्टि, यक्ष्मा में अग्नि की दृष्टि से ही पूरा जो है ये संप्राप्ति बनती है, तो उसको जो है हम डेफिनेटली जो है वो ले सकते हैं। तो कंपेरेबल जो है ये डेफिनेटली है। मॉडर्न टर्मिनोलॉजीज की बात करें तो ये दोनों जो है वो डिफरेंट हो जाती है। आयुर्वेद के हिसाब से हम उसको जो है ये ले सकते हैं, अगर हम कोई दूसरा नाम दे, क्योंकि बल की जब बात होती है तो उसका जो है वो बल क्षय के कारण रोग की वृद्धि, और स्पेसिफिकली जो 3 शब्द विषम ज्वर में चरक ने बताए हैं, तो ये 3 अवस्थाएं हैं जब ये संतत, एक तो ये भी है कि भाई संतत, सतत, अन्य दिवस, तृतीय, चतुर्थक, ये मलेरिया ना होकर के स्पेसिफिक फीवर से, जिनकी जो है ये कंपैरेबल पैटर्न जो है ये कंटिन्यूअस फीवर, इंटरमिटेंट फीवर, रेमिटेंट फीवर, उससे जो है वो कंपैरेबल है। और उसमें जितने डिजीजेस हैं स्पेसिफिक फीवर से, अभी मैं उसको जो है वो लिस्ट आउट नहीं कर रहा हूँ, तो वो इसमें जो है वो फॉल हो रहे हैं। जो एक दिन में टेम्परेचर जो है वो नॉर्मल एक बार आ जाए तो वो अन्य दिवस के 2 दिन जो है वो टेम्परेचर कम ये नॉर्मल रहता है, तो ये तृतीयक हो गया। तो इस प्रकार से जो है उसको जो है हमें ये देखना पड़ेगा। तो ये मेरा अभिप्राय है कि भाई ये हम ले सकते हैं। ट्रीटमेंट में डेफिनेटली जो है ये उसकी ट्रीटमेंट जो है ये करनी पड़ेगी, बल्कि ट्रीटमेंट हमें जो है ये करनी पड़ेगी। और प्रोटोकॉल की जब बात करते हैं तो हमारा जो है वो केंद्रित रहेगा भाई रोगी को क्या हो रहा है। तो मैंने जो यहाँ पर केसेस रखे थे उसमें जो पहला केस था उसको तो फीवर से जो है वो शुरू हुआ था कंप्लेंट, तो वहां पर जो है वो ट्रीटमेंट पूरी की पूरी जो है वो ज्वर चिकित्सा में जो ये कहा उस प्रकार से जो है वो ट्रीटमेंट की शुरुआत की। दूसरा केस जो है ये रखा था ये VDRL प्लस इसका था डायरियल कंडीशन का था। तो वहां पर पहले तो जो है वो डायरिया की ट्रीटमेंट, कुटक जो है वो बेसिकली डायरिया की ट्रीटमेंट है, तो वो जो है वो रखी। और उसके बाद जो है ये फिर शिफ्ट जो है वो ट्रीटमेंट में किया। उसके बाद जो तीसरा केस जो रखा वो यक्ष्मा से ट्यूबरकुलोसिस से हुआ, तो वहां पर जो है ये अजा दुग्ध की, अजा मांस का वैसे तो है, पर अजा मांस की जगह पर जो है वो अजा दुग्ध को जो है ये ट्रीटमेंट के रूप में जो है वो दिया था, जैसे व्हीकल दिया था। और उसमें रसोन प्रयोग भी किया था, मैं उसमें नहीं बोल पाया था, पर रसोन प्रयोग जो यादव जी त्रिकम जी आचार्य ने मॉडिफाई करके बताया है, तो वो रसोन प्रयोग भी जो है वो उसमें किया था, वो भी जो है वो यक्ष्मा चिकित्सा में है। तो मैं ये समझता हूँ कि जब हम ट्रांसलेशन की बात करते हैं तो यक्ष्मा ये समूह रोग है, सिंड्रोम ये समूह रोग है, इम्यूनिटी इसमें ये डिक्रीज हो रही है, और जो है वो एक्वायर्ड फैक्टर से हो रही है, एक्सटर्नल एजेंट से हो रही है। ये जो है आज के संदर्भ में हम जब इम्यून डेफिशिएंसी की बात करते हैं तो पूरा जो है वो आज लीस्ट ऑफ डिसऑर्डर्स है। आज ये नहीं है कि भाई जो है आपका रोमेटोइड जो है वो भी इम्यून डिसऑर्डर है, ये ऑटो इम्यून भी है, इम्यून डेफिशिएंसी भी है। फिर डायरिया है वो भी ऑटो इम्यून है, इम्यून डेफिशिएंसी है। तो कहीं ना कहीं जो है ये वेरी ब्रॉड कॉन्सेप्ट जो है ये आज जो है ये हो गया है। और ये मैं जो बात कर रहा हूँ ये एक ऑक्सफोर्ड टेक्स्ट बुक ऑफ मेडिसिन के संदर्भ से बात कर रहा हूँ, दूसरा जो है वो हैरिसन टेक्स्ट बुक ऑफ मेडिसिन के जो इम्यून डेफिशिएंसी डिसऑर्डर्स के जो लिस्ट है, जो उसका जो चैप्टर है उसके हिसाब से मैं इसको समझ रहा हूँ। जो मेरी समझन है वो इस प्रकार से ये है।
धन्यवाद प्रोफेसर शुक्ला जी। मैं समझता हूँ
Thank
हरीश
you very
शर्मा
much.
जी को अपना मिल गया होगा आंसर। एक चीज आपने अभी उठाई, अगर हम मॉडर्न मेडिसिन से देखें तो ट्यूबरकुलोसिस और एड्स ये अलग अलग हो जाते हैं, और उसका कारण विशेष रूप से इसका पॉजिटिव ऑर्गेनिज्म पे जाएगा। एक बैक्टीरियल है और एक वायरल है, शायद इसमें से वो ग्रॉसली चेंज अलग अलग है। सिम्टोमेटोलॉजी और सिंड्रोम के तौर पर तो हम उसको वाइडर सेंस में ले सकते हैं। आपका दोनों का बहुत बहुत धन्यवाद। आपने हमारी आज की वेबिनार की एक्टिविटी को और सक्रिय किया।
एक मैं डॉक्टर साहब एक इंफॉर्मेशन मैं और शेयर करना चाहता हूँ। जो लोग एड्स में इंटरेस्टेड हैं, ये राष्ट्रीय विद्यापीठ का एक बुक है, नेशनल कॉन्फ्रेंस ऑन एड्स एंड आयुर्वेदा।
जी है मेरे पास।
2002, हाँ 2000 में पब्लिश हुई थी। तो इसमें आर्टिकल्स हैं एड्स के ऊपर। तो जो लोग इंटरेस्टेड हैं वो लोग ये किताब भी पढ़ सकते हैं। इसमें काफी अच्छे आर्टिकल्स हैं।
जी, I attended that RAV conference and I have got the same voluminous book with me.
ठीक है, थैंक यू सर, थैंक यू।
Yes, Professor C.P. Sharma sir, you are invited. Please enhance some knowledge to our platform, because this is I think you will be the last one, because it's just going to strike 10:30. Dr. C.P. Sharma जी, आपका स्वागत है।
सर
नमस्कार नमस्कार।
नमस्कार सर प्रणाम सर।
जी सर।
जैसी अभी चर्चा चल रही थी सर, बहुत आयुर्वेद और जो प्रायः होता है एड्स के बारे में, ठीक है अपन सिमेट्री कर सकते हैं राजक्षमा से, या जो रोग समूह वाले, जहाँ रोग समूह, जहाँ नंबर ऑफ
थोड़ा आप कैमरा चेहरा में आपस में सामंजस्य स्थापित कर लीजिए, और थोड़ा ऊंचा, बस। गुड जी।
या सर सर्दी बहुत हो गई है ग्वालियर
तो
में।
ऊंचा कर लीजिए ना थोड़ा, स्टैंड मोबाइल का या कैमरे का। जी ठीक, अब ठीक है, बस दिस इज राइट। नहीं कैप की कोई बात नहीं, चेहरा आपका नहीं आ रहा था। यस ठीक है, थैंक यू
सर। तो जहां तक एड्स की बात है सर, ये विशुद्ध इम्यूनिटी, हमारी जब इम्यूनिटी कम होगी, इम्यूनिटी लॉस, तो आयुर्वेद में जहां पर ओजो व्यापद, ओज का वर्णन किया हुआ है, ओज क्षय, वहां पर हमारी बॉडी डिफेंस, इम्यून सिस्टम गड़बड़ा जाता है। अब वहां इम्यून सिस्टम जब गड़बड़ होता है, जब इम्यून सिस्टम हमारा न्यून हो जाता है, उस स्थिति में नंबर ऑफ डिसीज, जो सिंड्रोम आ रहा है ना, डायरिया हो गया, जुकाम हो गया तो उसको जीर्ण प्रतिशय में कन्वर्ट हो गया, खांसी हो गई तो खांसी ही हो रही है। फिर हमारी लाइन ऑफ ट्रीटमेंट, दो ट्रीटमेंट हमारे यहाँ डिक्लेयर्ड है, दो तरह की लाइन ऑफ ट्रीटमेंट हमारी है, सामान्य और विशेष। तो जहां एड्स वाली बात आती है, ये आगंतुक व्याधियों में आए, जो आयुर्वेद में वर्गीकृत किया गया है रोगों को, उसमें निज आगंतुक में फिर सेक्सुअली ट्रांसमिटेड डिसीज है, और होमोसेक्सुअल को ज्यादा होती है।
सर क्षमा करेंगे सर, इसका सिद्धांत पक्ष तो लगभग आ ही गया है, और हम समझते हैं कि पिछले 30 साल से आ रहा है। आपका व्यक्तिगत अनुभव, यदि आपका कोई एड्स का मरीज आया है,
आयुर्वेद की
चिकित्सा
बताता हूँ,
आप हमें लाभ दिलवाइए।
अभी मेरे पास 2 ड्राइवर थे, ट्रक ड्राइवर, उनको मैंने रसायन चिकित्सा दी। रसायन चिकित्सा में भी उनका ये कहना था, सर हम अफीम खाते हैं तो खाते हैं। तो हमने उसको जब डायरिया होता है, डायरिया उसका ठीक नहीं होता, उसको अफीम तो लेना ही पड़ती है। उसको कोई इंजेक्शन लगाए तो वो बोलता है सर डेली मुझे लेना है। तो हमें उसका वो एडिक्शन, जो एडिक्शन है, उस एडिक्शन का भी ध्यान रखना है। साथ ही औषधियां, रसायन चिकित्सा, एकल औषधि, हमने कहा आप तो अश्वगंधा खाओ, आप आम्ल की रसायन खाइए, आप च्यवनप्राश खाइए, या चरक का एक ओजस सिरप आता है सर, ओजस सिरप, उसके भी अच्छे रिजल्ट थे। तो ओजस सिरप, अम्ल की रसायन, आरोग्यवर्धनी, तो इस तरह के छोटे छोटे प्रयोग रहे।
ओजस
पेशेंट ज्यादा
ओजस
नहीं
सिरप
थे
तो
दो
ओजस
पेशेंट।
सिरप तो थोड़ा लग्जेटिव है और पेट साफ करता है, तो अगर उसको लूज मोशन का मामला है थोड़ा गड़बड़ करेगा। ओजस को जनरली
नहीं नहीं
बहुत
सर, लूज
माइल्ड।
मोशन हमारे पास जो पेशेंट आ रहा है वो लूज मोशन वाला नहीं है। जो अफीम खा रहा है उसको काहे को होगा लूज मोशन सर?
अच्छा, नहीं अट्रैक्ट है। जी जी जी, ठीक।
हाँ, तो उस स्थिति में हमने आरोग्य वर्धनी का प्रयोग किया, फलत्रकादि काढ़े का प्रयोग।
जी जी।
और जहाँ च्यवनप्राश में यदि हमें और कोई सिम्टम मिलते हैं, मकरंद ध्वज मिला दिया मान लीजिए हमने, देखिए क्या परिणाम आए। पेशेंट की पेइंग कैपेसिटी क्या है, क्या वो वास्तव में पे कर रहा है। तो हमें ओजो वर्धन, चाहे वो हम दूध पिला दें, उसको दूध में मुनक्का मिला दें, या हम उसको आम्ल की रसायन, मैंने तो सर चित्रक हरित की अवलेह में आम्ल की रसायन मिला के सेवन कराया, बहुत अच्छे रहेगा।
जी जी।
तो ये अपन रस औषधि और रसायन, अब अभी आ रहा था कि वो शुक्ला साहब कह रहे थे कि हमारे यहाँ राजस्थान में अजा बकरियों का तो सब इतना बड़ा दिया है, एक लाइन ऑफ शुक्रायतम ही बलम पुंसा मलायतम ही जीवनम। वो जो लाइन ऑफ ट्रीटमेंट है हमारी, जो उसमें उन्होंने कहा बकरियों के बीच में सोना है, बकरियों का ही दूध पीना है और बकरी का ही मांस खाना है। मांस नहीं खा रहे। अब उस बकरी को जिसका हमें दूध पीना है, अब हम उसको यदि उड़द और उड़द की जो भूसी होती है और उड़द की दाल का सेवन कराएं, तो हमें उससे उसके मांस के सेवन की जरूरत नहीं पड़ती।
ठीक है सर, बहुत बहुत
ऐसे
अच्छा
ही
इनपुट,
हमें,
बहुत अच्छा इनपुट है जी।
जी सर।
मैं
नहीं सर, मेरा
एक
तो पेशेंट मेरे पास कई तो ऐसे पेशेंट आते हैं जो अभी आएंगे, अभी मैं जाऊंगा तो रात को ही आएंगे। कौन आते हैं मालूम है आपको? मेडिकल कॉलेज के प्रोफेसर। क्यों? वो दिन में नहीं आना चाहते कि हमें आयुर्वेद का इलाज नहीं लेना है, और हम उनको एक्सपोज करते कि लल्ला दवाई तो लेनी पड़ेगी हमारी, या ठीक होना है। बोले नहीं नहीं साहब, मेरी बिटिया है फ्लोरिडा में रहती है, उसका जुकाम ही ठीक नहीं हो रहा, उसका जुकाम ठीक नहीं हो रहा। आपने पहले एक बार पुड़िया दी थी, उसने पूरी कॉलोनी का जुकाम ठीक कर दिया। तो ये
सर,
सब,
आप अगर आज्ञा
चाहे हम
दें
उसमें,
तो एक दो शब्दों से और आउटपुट इनपुट ले लें,
ऑफ
क्योंकि
कोर्स सर,
लेट हो
मोस्ट,
गए। हाँ,
बिल्कुल
थैंक यू
बिल्कुल
थैंक
सर।
यू
बहुत
थैंक
बहुत
यू।
धन्यवाद सर, आप समय दिया
धन्यवाद
आपने
धन्यवाद
मेरे
सर,
को।
आपका बहुत धन्यवाद आपकी नॉलेज शेयर करने के लिए। मैं देख पा रहा हूँ डॉक्टर साधना जी जुड़ी हुई हैं। अगर साधना जी, अगर आप कुछ इनपुट देना चाहें, स्वागत है आपका।
Dr. Sadhana Vaikar is Dean from Bhopal's Ayurvedic College.
Yes sir, thank you sir.
Welcome,
Thank you.
madam, welcome. If you would like to add anything, Dr. Sadhana Vaikar ji and Dr. Leena Karekar ji from
Yeah,
Gujarat.
exactly.
If you would like to add anything, madam. Dr. Swadhakar Reddy ji is with us, sir.
Yeah. I was keeping him in reserve. So just after Sadhana ji, because I know he is ours. So I think Reddy sir, yeah, Sadhana ji, madam, स्वागत है।
Sadhana ji, namaskar. Welcome you on the first time on platform.
Please unmute yourself. Yeah.
She is very commanding lady, very learned lady, and she is Dean of Faculty of Ayurveda in SAM Ayurvedic College. Welcome, madam. You are mute, madam.
You are mute. Unmute कर लीजिए।
Welcome.
नमस्कार सर, आप सभी का
नमस्कार मैडम।
और आप सभी को बहुत बहुत अभिनंदन। काफी अच्छा आपका वेबिनार्स और सब्जेक्ट बहुत अच्छा है, और आप लोगों की स्टडी जो सुन रही हूँ सर, वो काफी तारीफ काबिल है। जिन्होंने भी एड्स के ऊपर दिया है वो क्लिनिकली दिया है, पेशेंट के ऊपर क्लिनिकली जो भी उनका रिसर्च है वो दिया है। काफी सारी मेडिसिन हमें पता चली है। इस तरह से यदि होता रहे तो काफी अच्छा होगा। इसमें मैं थोड़ा सा एक प्रकाश डालना चाहूंगी कि हम लोग इस पे, जो सर ने भी कहा था कि रसायन चिकित्सा जो है एंड वाजीकरण, एंड अजा का जो उल्लेख किया है, तो मेरा मज्जा बस्ती पे काफी काम है सर। तो मज्जा बस्ती यदि जो अजा खा नहीं सकते उन्हें हम मज्जा बस्ती देते हैं, और मज्जा बस्ती का भी इस पे काफी अच्छा रोल है।
बहुत अच्छा, ये तो नई बात
बहुत
सीखने
सुंदर,
को मिली।
बहुत
जो
सुंदर।
नॉन वेजिटेरियन नहीं है
जी
वो
सर,
डेफिनेटली कर सकते हैं।
और उसमें
अजा
हम
की
बाकी मेडिसिन भी ऐड करते हैं, काढ़े जैसे रसायन जो भी मेडिसिन है वो काढ़े उसमें ऐड करते हैं, संधा उसमें होता है, मधु उसमें होता है, और इस तरह की बस्ती हम लोग देते हैं उसमें। तो ये नागपुर में काफी प्रयोग किया है सर इस पर।
बहुत बहुत
बहुत
धन्यवाद
बढ़िया,
मैडम आपको
बहुत
ऐड
बहुत
करने के लिए। दिस इज रियल
थैंक यू
वैल्यू
सो मच
एडिशन।
मैडम।
ओके,
मैडम को
आप
बहुत
कम
बहुत
से कम
धन्यवाद।
आप जुड़ती
वेलकम
रहिएगा।
सर। जी
हाँ,
सर,
आप
जुड़ती रहूंगी मैं।
और वो मैंने दिसंबर का प्रोग्राम भेज दिया है।
हाँ
जिस
सर,
दिन भी
जी
आप
सर,
बोलना
उसमें
चाहें
मैं,
मुझे प्लीज बताइए,
जी सर बिल्कुल।
हम लोग आपको
थैंक यू,
सुनना चाहते हैं।
थैंक यू सर।
थैंक यू सो मच मैडम। आपने तो बिल्कुल नई
थैंक यू।
विधा बता दी कि अजा मांस रस उसका मज्जा निकाल के बाकी
जी
सेंधा
सर, और मज्जा
सेंधा
का भी
काढ़ा और
उसका एक
लवण है।
मेरा एक प्रोसीजर है। हम पेशेंट को ही बताते हैं कि वो लाके उसको जो पीसेस करके देते हैं लोग, मतलब जो बेचते हैं वो, तो उनका हम कुकर में कम से कम 15 से 20 सीटी लगाते हैं। उन्हीं को बताते हैं, पेशेंट करके लाते हैं।
तो वो मांस रस निकल आता है उसमें से।
हाँ, मांस रस, अस्थि और मज्जा का पूरा जूस आता है उसमें।
अच्छा अच्छा, उसको आप मतलब विद बोन्स वाला पीस लेते हैं
हाँ, बोन्स वाले जो पाया आता,
अच्छा,
पाया की बात
हाँ,
कर रही हूँ मैं।
पाया, क्योंकि अन्यथा तो
पाया,
मज्जा तो
पाया।
बोन के अंदर होगा। राइट,
हाँ, पाया
आपने
की
और
बात कर रही हूँ, और पाया में सबसे ज्यादा मज्जा होती है।
बिल्कुल बिल्कुल, दैट इज द सीट ऑफ द मज्जा।
या
थैंक यू।
तो वो लाकर पेशेंट घर में वो सब तैयार करता है, उसको छानकर जो जूस निकलता है वो हम लोग बोलते हैं कि फ्रिज में जो क्यूब्स
तो
होते बनाते हैं ना,
आपको तो एनकरेजिंग रिजल्ट्स मिले हैं इसके?
हाँ सर बिल्कुल मिले। इसमें हर मज्जागत, रक्तगत में तो काफी अच्छा है। इवन मैंने ट्यूबरक्लोसिस,
पेशेंट्स का पूरा कॉपरेशन रहता होगा इस मामले में।
जी सर रहता है।
दैट्स गुड, दैट्स गुड। थैंक यू मैम, थैंक यू सो मच। प्लीज डू कंटिन्यू।
और सुनिए ना सर, उसके क्यूब बनाते हैं फ्रिज में रख के, और जब भी हम बस्ती देते हैं तो 1 या 2 क्यूब वो लाकर देता है पेशेंट,
नेक्स्ट
और
टाइम यूज
उसका
कर
हम
सकते
फिर
हैं।
प्रोसीजर करते हैं।
बहुत बढ़िया, बहुत सुंदर, ग्रेट ग्रेट अचीवमेंट। डॉक्टर लीना
अग्निहोत्री
जी मेरे
साहब,
से जुड़े हुए हैं। डॉक्टर लीना जी,
अग्निहोत्री
आप
साहब,
थोड़ा इनपुट दीजिए। जी नमस्कार।
अग्निहोत्री साहब, बीच में
जी।
मैं आपको इंटरप्ट करना चाहूँ।
मुझे घड़ी कह रही है कि जल्दी से जल्दी पैकअप करना है, तो डॉक्टर लीना जी आप तैयार रहिए। डॉक्टर सीपी शर्मा जी कुछ इंपॉर्टेंट बातें आ रहे हैं, आप बताइए सर।
मैडम ने का एक छोटा सा अनुभव है
जी।
मैं राजस्थान में था, सादुलपुर चूरू डिस्ट्रिक्ट में सर। वहाँ डॉक्टर मीणा हुआ करते थे, एमबीबीएस थे, पीडियाट्रिशियन थे। उनके बेटा हुआ, उस बेटे के दस्त बंद नहीं हो रहे थे, दस्त ही बंद सब। तो जो फाइनली जब रिजल्ट आया, पूरे चेकअप कराने के बाद उनकी का माँ के दूध से एलर्जी है।
माँ के दूध से एलर्जी?
माँ के दूध से एलर्जी जी। तो अभी बस्ती वाली जब बात आई तो हम बैडमिंटन साथ साथ खेलते थे, मीणा साहब, हम और एक डीएसपी साहब थे वहां पर। तो हमने कहा भाभी जी बोले आपका आयुर्वेद पढ़ा है इतना है, अपने पीएचडी कर ली और चेक कर ली, वो कर ली, बेकार है आपका पढ़ना, मेरे बेटे की दस्त बंद करो। तो उन्हें कि हम कर देंगे बंद, आपको परेशान करेंगे। बोले बताइए। तो मेरे को सर चरक में एक जगह लिखा है मात्र क्षीर बस्ती
जी।
मात्र क्षीर बस्ती। मैंने कहा मुझे आपको अपना दूध देना पड़ेगा डेली 10 cc 10 ml सर। 3 दिन बस्ती लगाने के बाद हिसार का पीडियाट्रिशियन ये कह रहा था ये क्या हुआ, और वो बच्चा आज इंजीनियर है, आज तक उसको दस्त नहीं लगे।
सर ये तो न्यूज फ्रंट पेज में आनी चाहिए थी टाइम्स ऑफ इंडिया में। तो ग्रेट, मेस्मराइजिंग, इट्स रियली ग्रेट। मतलब मात्र दुग्ध से हिक्का की तो चिकित्सा हमने भी की है, लेकिन आप तो मात्र दुग्ध से इनफर्टाइल डायरिया को आपने ठीक किया है।
सर बिल्कुल इजी हो गया, मैं पूरा इसका रिकॉर्ड निकाल सकता हूँ।
आप तो अभी भी देखिए, आप दीजिए, यहाँ से लेके कैम्ब्रिज तक छपेगा। आप उसको अब तो आप क्लेम हो गया कि बच्चा इंजीनियर हो गया, तो निश्चित रूप से वो भी कहेगा हाँ भाई हम वही हम है। डॉक्टर लीना जी आप अगर हैं तो थोड़ा आप भी बताइए। डॉक्टर लीना जी।
हेलो।
हाँ, स्वागत है आपका।
आज का वेबिनार तो बहुत ही अच्छा हो गया और नई नई चीजें आज हमको सीखने को मिली है और मैं आप सबका आभारी हूँ कि हमको ऐसे नए नए मौके आप दे रहे हैं। बाकी मुझे कुछ बोलना नहीं है सादा।
आप जुड़ते रहा करिए और सब्जेक्ट
नहीं, मेरी रिक्वेस्ट है लीना जी से और साधना जी से कि वो दिसंबर का प्रोग्राम देखें और कृपया हमें सूचित करें कि वो किस दिन बोलना चाहते हैं।
जी सर,
क्योंकि इस बार हम थोड़ा फॉर्मेट चेंज कर रहे हैं कि हम 2 या 3 ही स्पीकर रखेंगे, क्योंकि रात के 9 बजे का समय है, तो मैक्सिमम 10:30 तक हम खत्म कर लें, ऐसा हम चेष्टा करेंगे। तो लेकिन आप लोग किस टॉपिक पे बोलेंगे, काइंडली गाइड अस। और नए नए टैलेंट्स को भी रिकमेंड कीजिए जिनका प्रैक्टिकल एक्सपीरियंस हो।
प्रैक्टिकल, या
राइट मैडम।
ठीक है सर, धन्यवाद।
थैंक यू अग्निहोत्री जी।
थैंक यू सर, थैंक यू। आज हमारे न केवल हमारे गेस्ट स्पीकर्स बल्कि हमारे वेबिनार में जो डिस्कशन में, ओपन डिस्कशन में जो हमारी आज की हस्तियां जुड़ी, डॉक्टर CP शर्मा जी, डॉक्टर हरीश शर्मा जी, डॉक्टर महेश शर्मा जी, डॉक्टर साधना जी, डॉक्टर लीला जी, इन सब ने अपने जो व्यक्तिगत अनुभव, विशेष रूप से चिकित्सा के क्रम में जो लाइन ऑफ ट्रीटमेंट या जो शास्त्रोक्त था उसको प्रैक्टिकली प्रयोग में लाके जो सफलता प्राप्त की, वो आगे आने वाली पीढ़ी के लिए एक बहुत बड़ा धरोहर है, बहुत बड़ा संदेश है और उनको एनकरेजमेंट भी है कि वो इस चीज को आगे ले जा सकते हैं। और बीमारी चाहे कोई सी भी हो, अगर चरक के सिद्धांतों के अनुसार और विशेष रूप से उनकी जो सिद्धि स्थान और कल्प स्थान की जो बहुत ही धरोहर है हमारी, उस पर अगर लेके चले, उनमें जो उपलब्ध रहते हैं द्रव्य, स्पेशली साधना जी ने बताया कि हमने जो अजा मज्जा की बात रखी, तो ऐसे कुछ प्रयोग
सुधाकर रेड्डी जी आज शांत हैं सर। सुधाकर रेड्डी जी शांत हैं।
प्रोफेसर पी सुधाकर रेड्डी जी, स्वागत है, आइए। आपके बिना ये फिर माहौल कैसे पूरा होगा? जी स्वागत है, नमस्कार
सर। नमस्कार sir. This is a very, I think it is a good time for everybody to join 9 o'clock and even 8:30 also good because 8:30 सब clinic से आते हैं, घर में बैठते हैं, ये अच्छा टाइम है सर। First of all, I would like to extend my thanks to all the dignitaries. Sharma sir, today's webinar was very nice webinar, sir, because we got 2 things which I learned, Majja Basti, that yes. Sadhana madam, और एक मातृ क्षीरा बस्ती, another Shivishukha Sharma sir, and those speakers excellent, sir. Sir, one thing I would like to say that when AIDS in modern pathology, when virus enters into the body, it directly enters in the WBC. Again, WBC CD4 cell. That CD4 cell again it enters in the CD4 cell. What you can cell nucleus. So any drug should act on the virus. It should destroy the cell of the CD4 cell. If cell of the CD4 cell is destroyed, our immunity will be destroyed. That is why they says that there is no drug which acts on the CD4 nucleus. So because of this reason, there is no treatment till now for the AIDS. Even much more scientific, the world is scientific medicine available. Still, they could not able to do because of only this reason, sir. But as far my knowledge goes, the presenter, first presenter, sir, Nishant Shukla, sir, whatever sir mentioned, so there the drugs of Ayurveda may not be killing the virus, but certainly they reduce the viral load and improve the quality of life. That's what I can say, sir. And my guru, Dr. Rama Shastri in Hyderabad, when we are BAMS, that time, during 1980s, sir, I'm telling, because in 1980s there was a AIDS pandemic striking was. During that time also, he has only used 3 drugs, sir. That is Amalaki, Guduchi, and Shetavari. These 3 drugs he could able to manage the symptomatically. But he says that we can't treat completely because we can't kill the virus. But still, Ayurveda Rasayana will be useful to improve the quality of life and reducing the load, virus load in that one. So that was they mentioned, sir. And regarding Rajayakshma and AIDS, there was a discussion. But as per knowledge goes, sir, the modern, when they say AIDS means definitely the patient should have one opportunistic infection. It could be tuberculosis, it may be sarcoma, it may be any herpes virus, etc. So there we can say that without a opportunistic infection, we can't say AIDS at all. So here in this in Ayurvedic terminology, Rajayakshma, all the symptoms are there in the AIDS patient. That we can say that. So most of the AIDS patient, the opportunity is only tuberculosis. It starts number 1. And number 2, herpes zoster, etc. So Ayurvedic way, there is a relation between the Rajayakshma and AIDS, sir. And there the Bala and Ojas. These two are the immunity enhancer to the body according to Ayurveda. So these two will be reduced in the Shukrashaya, Vojokshaya. So that way you can link it. So our drugs should promote the Shukrashaya and also the Dhatu Vriddhi and Shukra Vriddhi, and the same time Bala Vriddhi. So these drugs can act as a quality of life improving. That's what I can say, sir. But I'm not having any practical experience, but theoretically, I know very well these terminologies. And my guru, he has treated, and also in government Ayurveda Medical College, a PG student was taken up a study to reduce the CD4 count in the HIV patients, sir. That also, same thing, Shatavari and Guduchi, Amalaki combination. It was used a polyherbal combination. Excellent result was there, sir. But still, what modern people says means, you can't treat. Okay, we can't treat because nobody can treat, because nobody can kill the virus. Once virus enters into the body, it stays lifelong. But only thing is that we can improve the quality of life, and also we can improve the aging of the people also. That longevity also can be improved. That is what I can say, sir. Thank you very much, sir. I hope I had done something. If any mistakes are there, please forgive me, because there are good platform is there today, sir. Thank you very much, sir.
Thank you very much. Thank you very much. I would like to request you all to communicate our message to all next generations and all faculties, because we are doing this holy mission for all, generally especially for next gen. So please communicate, please try to involve them.
Yes, sir.
We are here due to job bombarding, so we are not involving directly, but you can involve.
Yes, sir. Yes, sir.
Agnihotri. Agnihotri, sir.
Yes, sir. So with this all submission of each and every person, all distinguished guest speakers and our debaters and panelists, I have got only a few words to say. Thank you all. Thank you all for your all sort of contribution for today's webinar. Thank you so much. Namaskar.
Thank you. Thank you very much. Thank you to all. Good night.
Namaskar, sir. Namaskar, sir.
Good night.